morning to you in the second hour of TRAXX Momentum, 11:15. And what does that mean on a marvelous Monday? It is Health on TRAXX with me, Anil, on the mic. You know, your health is one of the most important things because if you don't look after your health, it will affect your mental health, your physical health, and an overall quality of life gets disrupted. And that's why we at TRAXX play a very proactive role because we care about you and we're concerned and we want you to be fueled with the right information that is out there, not just from anybody, but from experts. And that is the case. I have an expert today in the studios with me. Her name is Dr. Fatin Hanisah Firman. She's a consultant ophthalmologist from Uitm Private Specialist Center. And she's given me the privilege to refer to her as Dr. Fatin. Dr. Fatin, good morning. How are you?
Good morning, Anil.
Okay.
I'm great, thank you.
Good to hear from you. And you are here today to talk to us about our eyes. And in particular, we're going to speak about dry eyes and the Meibomian Gland disease.
That's right.
Something that sounds pretty alien to me for the first time, but yes, you're going to enlighten all of us. But before we dive into our topic today, Doctor, could you please just give us a brief introduction about yourself and your specialization?
All right. Thanks, Anil. I'm happy to be here. Thank you, TRAXXfm, for having me. So I'm Fatin Hanisah binti Firman. I'm an ophthalmologist practicing at Uitm Private Specialist Center in Sungai Buloh. The mainstay of my work consists of performing cataract surgeries, treating in-office diseases such as diabetic retinopathy, dry eyes. I perform both surgical and clinical ophthalmology diseases, basically.
I see. Great. Okay. Now that we've already set the scene, we know very well that we're speaking to an expert. I want to jump right headfirst into the topic today. Most people may be familiar with this, but there are also fractions of people who are unfamiliar, which include people like me. I've never heard of this. So give us an explanation, Doctor. What really is the Meibomian Gland disease and how does it affect us?
All right. So Meibomian Gland disease refers to diseases of the glands that line the upper and lower lids. So we have all glands in these upper and lower lids that secrete a secretion called meibum. So what this meibum does, it goes and coats over the ocular surface, forming the lipid layer of the tear film. So this prevents the tears from basically evaporating and causing dry eyes. So basically, Meibomian gland is one of the commonest or the most important factors that cause dry eyes. So about 85% of cases of dry eyes are caused by Meibomian gland disease. So it's something, although unfamiliar to many, can affect quite a number of the population. So I think it's important for a lot of people to know about Meibomian gland disease.
Is it hereditary or is it something that arises due to the conditions a person is exposed to?
Some factors come into play. So age is one factor. So women tend to get Meibomian gland disease a bit more than men. So perhaps a hormonal issue as well. But currently we see that even among the younger population, perhaps due to use of digital devices, so they tend to get a bit more dry eye and also Meibomian gland diseases. So I think this goes across the board. But the other risk factors include diseases that cause dryness. So there's a disease called Sjogren's syndrome, which causes dryness of all the mucous membranes. So that can cause dry eye as well. But when you look at Meibomian glands themselves, so Meibomian gland disease affects the glands in its structure. So some of the glands get destroyed. The contents of the Meibomian glands gets changed as well. So that can be caused by the bacteria, sometimes the bacteria on our skin that goes into the Meibomian glands. So they alter the melting point of the fatty acids within the Meibomian glands. So what happens is that instead of when you squeeze the Meibomian glands in a healthy person, you're supposed to get an oily, clear kind of fluid coming out.
Okay.
But in people who suffer from Meibomian gland disease, what happens is when you press on these glands, what comes out will be more like a gel-like substance.
Very viscous substance.
And in severe cases, they come out like toothpaste even. So much thicker. So in these kind of patients, you know that they've had Meibomian gland disease for a while, and they will most likely suffer from the symptoms of Meibomian gland disease and dry eye disease.
You mentioned something interesting, Doctor, that a lot of parents are battling with people, adults like us as well, exposing ourselves too much to mobile devices. And parents are trying to retract their kids very hard from stopping their kids from having too much screen time. Are kids susceptible to this as well?
They're more susceptible to dry eyes in general, not necessarily Meibomian gland disease. It's just because when you look at devices or you spend too much time on devices, your blink rate is less. You blink less. We we can't control when we blink usually. We can control them, of course, but the reflex blinking, the blinking that we do day to day, we don't have to think about it when we blink.
Right.
So when we look at devices, even when we watch television, but primarily when we're looking at something close up, you tend to blink less. And when you blink less, you also don't blink completely because you're trying to focus on something very interesting.
Yes.
So you are trying to capture as much of it as possible. So you don't blink as much, you don't blink completely. So what happens then is your tear film doesn't coat the eye properly. So because of these changes in the blinking mechanism and the distribution of the tear film over the eye, that's when you get dryness coming from it.
I see.
And of course, when you're on something interesting on your phone, for example, you're not going to be there for the next 10 minutes. You're going to be there for half an hour or 45 minutes. And before you know it, an hour has passed by. So that prolonged period of being on the device, as opposed to maybe 5 or 10 years ago, that has definitely changed the structure, how we see people present with dry eyes now. A lot of it is attributed to device use, basically.
I see. Is it just driving in the car as well? You know, cars back in the days were equipped with a manual speedometer, but now you got a screen in your car.
You do.
As well.
And all these high-tech
screens,
panels.
Panels,
I mean, your GPS is now fixed in the car, for example. Screens are everywhere. You can't avoid them. Even billboards now are now screens as well.
Yeah,
so
I know. It's like, I think you got to put a reminder on your dashboard. Don't stare at your speedometer for more than 6 seconds. Look at
it's
the road.
important, actually. I think setting reminders just for ourselves to just take breaks in between. Sometimes screen time is inevitable. For some people, work requires prolonged screen use.
Yes.
So they can't not look at the screen, but taking regular breaks in between is important.
Right. Okay. Good point there. Thank you very much, Doctor. We'll jump in for a quick break. When we come back, we'll resume with the discussion. Today on Health on TRAXX, we're talking about our eyes with Dr. Fatin Hanisah Firman. She's diving deep on discussing on the Meibomian Gland disease as well as the dry eyes condition. We're jumping for a quick break. When we come back, we shall resume with this very interesting conversation. Don't go anywhere. Keep it right here. TRAXX Momentum. Good morning, everybody, and welcome back to Health on TRAXX right here on TRAXX Momentum. We had a little bit of an issue there playing the promo. And today on Health on TRAXX, we're talking about something that is very important. That's why I've removed my spectacles to put more emphasis. I couldn't emphasize this anymore because imagine not being able to enjoy everything around you and appreciate the wonders and the beauty of the world without having your beautiful eyes. And yes, I have been using my spectacles for a long time. And speaking to us today about dry eyes and this is a bit of a mouthful, isn't it, Doctor? Meibomian Gland disease.
You're doing great, Anil. Meibomian Gland disease.
Thank you, Doctor. I'm speaking to Dr. Fatin Hanisah Firman, a consultant ophthalmologist from Uitm Private Specialist Center. Dr. Fatin, welcome back to Health on TRAXX.
Thanks, Anil.
Off air earlier, we were sort of continuing with what we left off before the first break, which was how inevitable it is that we get ourselves exposed to panels and screens that it's even in our cars and our dashboards, and then we sort of segued, and you mentioned something pretty interesting, getting our eyes exposed to air conditioning. The blower. Tell us about that, Doctor.
So having direct air blowing in our eyes, so basically when you talk about evaporation being the issue here, so when you have movement of air across the surface of the eye, so that will cause evaporation to occur even more than usual.
Okay.
So when you are sitting in a condition where air-conditioned air is blowing in your face, such as being in an office where the air conditioner is facing you, for example,
right,
or in the car when you're driving, which is inevitable in our hot weather right now.
Right.
So those conditions can even worsen dry eyes.
Wow. So that condition can worsen dry eyes as well. Wow. Yep. I never knew about that. Now let's touch on the statistics, Doctor, and see how this condition is prevalent in our country. Give us a picture.
Okay. So there's some studies that have been done to look at the numbers of patients who have dry eyes. So the statistics show that it's about between 15 to 25% of the population suffers from some degree of dry eyes. So that translates to maybe 3 to 7 million, which is quite a number, Anil. But of course, some patients, this disease in itself is underdiagnosed, it's underreported, because some patients think that, this is aging, this is just simply, just some discomfort. Some patients treat themselves over the counter by buying artificial tears over the counter in the pharmacies. So of course, this data may be actually an underrepresentation of the actual figures.
Yes,
but we're talking millions, maybe upwards of 10 million Malaysians who suffer from it. So that's quite a huge number, actually.
Yeah. I think I can relate to that because we've definitely had conversations with friends, and so have I. Whenever it comes to things that concern the eyes, we tend to ignore it as long as we can still see, but then we only pay a visit to the optician or the ophthalmologist the moment we start, when you can't see, or we start frowning too much, which is a mistake that I did, Doctor. I was having some issues, blurry vision, but then I just, brushed it under the carpet. And then eventually at some point, my mom would always remind me and say, why do you frown that way? Do you know that it just makes you look horrible? And I was like, do I frown? Yes, you do. And that's when she took a picture of me, and I was really frowning and squinting so badly. And that's when I realized, oh my God, my eyesight had deteriorated. And
it took someone else noticing that you were frowning for you to get.
Yes, it was so automatic. Yeah,
I think with the eyes, as you say, they are the window to the world.
Yeah.
And we are very sensitive about how our eyes because we don't want to touch. We don't want things to come into our eyes. We don't want to touch our eyes. Similarly with teeth, I think people are quite sensitive with this organ. So as much as possible, you don't want to get it checked. We don't want anything bad to be happening to our eyes. So I think that's why people tend to think, okay, maybe
it's the anxiety, that fear of getting bad news.
Yes,
right.
It's more the fear, the worry, not knowing will be better than knowing something's going on with the eyes. Right. I think that could be the case. It's anyone's guess, though.
Of course. Back to the Meibomian Gland disease, Doctor. Right. Talk to us about some of the symptoms that someone...
Okay. So this can vary. All right. So most patients will complain of things such as grittiness. So foreign body sensation, sometimes even in severe cases, a sensation of stinging or burning in the eyes.
So when you say in the eyes, on the surface of where the retina is, or at the back, or where?
On the surface. Basically, this is all on the ocular surface.
Right. Also, that's called the ocular surface.
Ocular surface, we call it. So it's all in the front of the eye. All the problems are happening in the front. So what can happen is that some patients, they even get, especially if the dryness has been there for a while, what they can get is actually a sensation of eye fatigue, tiredness, and also blurring of vision towards the end. Because as the disease develops, what happens is the front part of the eye, the cornea, which is akin to the car windshield. basically.
Right.
So it gets the epithelial cells lining this corneal surface is sloughed off. It becomes unhealthy, so you can get some blurring of vision as well. I've got an interesting symptom that I think a lot of patients don't realize happens in dry eyes. So they get tearing. So that sounds a bit counterintuitive, right? So why would you have tears?
Contradicts the symptoms, right?
So what happens with tearing in dry eyes is that you get your eyes are dry. So it tells the brain, make more tears.
So it's the body's mechanism of just trying to reciprocate. Okay.
But the tear film itself is consisting of 3 different layers. So it's the lipid layer, the aqueous layer, and the mucin layer. So there are 3 different layers there. So when the brain, when the brain forms new tears, it just tells the lacrimal gland, which is a gland that's to the top right part of the eye there, to form the aqueous portion only. So it forms this aqueous portion. This aqueous portion coats the eye, but it doesn't remain in the eye anymore because of the problem happens with the lipid layer or the mucin layer. So these tears will just flow out of the eye and becomes tearing, or before eyes we call it. So whenever I have patients who come in with tearing and then I tell them that they have dry eyes, they give me a blank face and like, are you sure, doctor, that this is what I have? So I have to explain this mechanism to them and let them know that this is very common.
Right.
And as they find, and I'm giving them artificial tears, I'm putting more fluid in the eye. So, but as they continue with their treatment, this tearing gets less, and then they're convinced that that's like the actual pathology that's happening.
Now, let's encourage our listeners to do something to get their eyes checked now. Well, let's start that off, Doctor, by you giving us maybe a very brief tip on how they can perform a self-assessment at home to see if
the dryness is there. Okay, so watch out for the symptoms that I've mentioned. So I think when we are doing our daily activities, especially when we are having a lot more screen time or when we are driving, watch out for all those symptoms that I've mentioned. Do your eyes sting? Do you feel like there's some foreign body sensation going on? Are there tearing? Okay, and if, say, while waiting to go and see a doctor, for example, you can even try some home remedies, so to speak. Or try to see whether you, by buying an over-the-counter artificial tears, see whether that relieves the symptoms. Of course, I'm not saying that everyone should just be home, treating themselves at home. It's still best to have yourself checked by a professional or an ophthalmologist. But there are certain things that they can try. Placing humidifiers in the home, for example, or using glasses, sunglasses when they are driving, or those wraparound glasses just to prevent a lot of blowing air from going across the eye surface are things that they can try as well.
Right. Now, supposing someone has these symptoms, doctor, they've realized and they pretty much ticked all the boxes that you mentioned. What should they do next?
Find the nearest ophthalmologist and get themselves checked.
Not an optician, but
not an optician, if possible.
That's another distinction that we need to. Doctor, yes. I think I couldn't find a better time than to sort of enlighten our listeners so that we can have this distinction that an optician is not someone who can medicate you when it comes to problems. No, right? No. Yes, a lot of people don't know that.
Actually, I would love to talk about this because it's been misunderstood for the longest time.
Of course.
Okay, so we have 3 different parts. So we have an optician, we have an optometrist, who's not an optician, and an ophthalmologist. Okay, so an optician, which is someone who is trained in the making of glasses, basically, providing patients with glasses. An optometrist is someone who had 4 years of training, basically university training, in order to prescribe glasses. They can treat certain eye diseases, all right? They are allowed to, but they don't prescribe medication, so they can offer recommendations. They're very good at checking the eye power, so all of this, us with glasses, would have been very familiar with optometrists. All the many years that you've been wearing glasses. So an ophthalmologist is a doctor who has gone to have further specialist training in the eye. And we are allowed to operate on the patient's eyes. We are allowed to treat patients' eyes with medications that need to be prescribed.
Which includes performing cataract procedures,
cataract
surgeries,
on and
so forth.
etc.
I see. Okay. Thank you very much, Doctor, for doing us that favor. I think we can make very good TikTok content out of that. Dr. Fatin giving us the difference between
an optician, optometrist, and an ophthalmologist.
I'll jump in for a quick break. When we come back, we'll resume with this discussion. Today on Health on TRAXX, Anil on the mic is speaking to Dr. Fatin Hanisah Firman, a consultant ophthalmologist from Uitm Private Specialist Center, and we are speaking about the Meibomian Gland disease as well as the dry eyes condition that some of us have. Don't go anywhere. We'll be right back. morning, everybody, and welcome back to Health on Tracks right here on TRAXX Momentum. My name is Anil on the mic, and today I am speaking to Dr. Fatin Hanisah Firman. She's a consultant ophthalmologist at Uitm Private Specialist Center, and she's today talking to us about the Meibomian Gland disease as well as the dry eyes condition. Dr. Fatin, welcome back to Health on Tracks. Now, Doctor, I want you to give some good news to our listeners, because I think over the last 20 minutes we've sort of given them a rain check for them to sort of pull themselves back from all of these bad habits, which i.e. includes screen exposure, excess screen exposure, so on. How advanced are we in terms of treating this condition? What's the good news, Doctor?
Okay, so the good news is that even though the eye is seemingly such a small organ, there are many things that can be done to look at the problems related to the eye.
Yeah.
And there are many things that can be done to treat Meibomian gland disease in dry eyes.
Sure.
So we talk about what we can do to look at it. We can start by just the simple in-office procedures. So when your patient comes to me complaining of symptoms of dry eye, there are a few things I would take a look at. So one of the things I would do is we would stain the eye with just a drop of a dye called fluorescein.
Okay.
So it sounds a bit scary, me putting a dye on the surface of the eye, but actually it's quite pain-free. We give you a painkiller. It comes with an anesthetic drop, basically.
Okay.
So that will coat the ocular surface and it will tell me whether the cornea is healthy. So if there are areas where the cornea seems to have some pinpoint areas of fallout of the epithelium, that tells me that the cornea is unhealthy because of dry eye. You can also look at the tear film itself and see whether the tear film will break up faster. So when the tear film breakup time is low, it breaks up too fast. It means that the eyes evaporate much faster than a person with a normal tear breakup time. So that comes, and then there's also a test called Schirmer's test, which is basically a strip of paper that you place in the eyelids to measure the tears that are formed by the eye. So these are the simple in-office procedures that don't require us sitting at a machine or anything like that. So you're talking about more high-tech things, so they are. Okay, so there are several machines that can actually look at, you can visualize those Meibomian glands that we were talking about. So they can look to see whether the Meibomian glands are, whether they are abnormal in shape, whether there's fallout, some of them are no longer functioning.
So you can make a detailed assessment of the condition of the glands.
Yep, physically, structurally looking at each individual gland to see whether it's there, and the machine can even scan and give a percentage of which ones are how many percent of the glands are working well.
Wow!
And there are also machines that look at the tears themselves, the dynamic movement of the tears. So it tells whether the tears are formed properly when you blink. And there are some machines that can measure the osmolarity of the tears.
Osmolarity.
Yep. So if the tears are a little bit more salty, for example, that's higher in solutes, means it's less of water, it means that the eyes are evaporating too much, and therefore the osmolarity is higher in those patients. So this all tells us, these are all the investigations that we can do in terms of finding out the degree of dry eyes.
So if my tears are salty, is that good? Is it a good sign or a bad?
It's a bad sign. The osmolarity is higher, which means that the eyes are drier.
Yeah. I see.
So in terms of what we can do to treat the eyes, that's a whole Pandora's box.
Yes.
Multiple things can be done.
Okay.
So as I mentioned, there are several things, especially when Meibomian gland disease is the main cause of the dry eyes. We can tell patients to do several things even at home to help with the treatment that we're giving them at the same time. So we recommend using performing lid hygiene or lid wipes. So you can either do that by getting a commercially purchased lid wipe, or you can even use cotton buds dipped in baby shampoo that's diluted to just clean the ocular surface.
I see.
Right at the lash, at the lid margin. So ladies who use eyeliner, they know exactly where to put that.
Baby shampoo.
Diluted baby shampoo, not to take it out straight out of the bottle.
Right.
So a bowl of water with a few drops of baby shampoo is adequate.
Right.
Okay. And the next thing that we recommend them is to do warm compressions or using a warming eye mask. So that helps open up all those glands that we were talking about. All right. And I've mentioned using a humidifier. So those are the things that they can try at home. Right. So once they come and see me, things that I would recommend, of course, initially, their eyes are dry. We shall replenish the tears. So within artificial tears, there are a range of different types of tears that we can give. So some of them have different components. So some of them have lipid added into them. So the regular artificial tears we buy in the pharmacy, they're just clear fluid that you drop into the eye.
Right.
There are some formulations that are a bit more lipid has a higher lipid content. So those are actually whitish. And when you place them in the eye, your eyes will be a bit blur for a few seconds until the eyes sort of regulate everything back to how it was.
Okay.
And then, so those artificial tears can be given for patients who we know, who upon investigation that we see that the lipid layer is the problem. There are formulations of different viscosities as well. So there are tears that are artificial tears that are in the gel form, artificial tears that are in very almost like an ointment kind of artificial tears.
Right.
So it different formulations for different types and levels of dry eye disease.
Right.
Interesting thing of note is that even if you're buying artificial tears outside, there are formulations that are preservative free. So look out for those. Because preservatives in themselves can affect the ocular surface. You already have all these problems, inflammation on the eye and all that, and then you're giving something that worsens that inflammation. So try to find preservative free formulations. So they can come in a big bottle, but it says there on the label it's preservative free, or they come in those individual vials where you have to crack them open and you have to use them up within 24 hours. So either one would be suitable, but as long as you say preservative free, those are recommended. So artificial tears aside, so you're talking about how Meibomian gland is a disease where sometimes it's bacteria coming in there. So we can treat them, especially in those more chronic cases in which the symptoms have not been relieved by artificial tears at home. So they've tried many things at home and that it still hasn't resolved. So we can try antibiotics. So two different groups. We have tetracyclines and macrolides. So different antibiotics that we can give just a short course of. And then once they've completed that course, usually we find that the Meibomian gland secretions are a lot better. Other than that, because it's an inflammatory condition, so some medications that contain steroids in the drops, as well as immunomodulators such as cyclosporine can be given, but these are prescribed by ophthalmologists only and have to be closely monitored. So patients can't just be using steroids on their own outside. So there's a danger of the eye pressure going up with the steroid use. So that is one thing that I think we should mention as well.
You mentioned about it's an inflammatory condition. So does a patient need to also sort of alter their diet to reduce the side effects?
Not so much the inflammation part, but there have been some studies that show that increased consumption in omega-3 helps with dry eye symptoms caused by Meibomian gland disease. In terms of inflammation, not so. But I think with that's another remedy that they might our listeners might want to try.
Right. Okay. Dr. Fatin, I have to say this has been a very enriching conversation with you today. A couple of weeks ago, I spoke to a dentist and I didn't let the dentist go until he thought us the right way to brush our teeth. And then I remember her even speaking to an otolaryngologist, and she thought us the proper method of cleaning our ears. So it would be a waste if I just let you go without asking you, Doctor, how do we take good care of our eyes?
All right. Okay, so last tips. All right. I would say, first things first, no rubbing. A lot of people love to rub their eyes.
Yes, like me.
I tend to do it myself sometimes. But I tell my patients, and I also try to tell myself not to rub your eyes as much.
Achu, don't forget, don't rub your eyes, yeah?
Have you caught her rubbing her eyes?
No, I haven't yet. She's good.
And then again, taking frequent breaks. We are inevitably exposed to too much screen time, whether we like it or not.
Right.
Too many screens capturing our attention. Our work requires a lot of screen time, so take frequent breaks. All right, so every 20 minutes, take a break, go grab a cup of tea, go to the bathroom, have a glass of water, do something to just stop that increased exposure. Your eyes will thank you later.
Of course. And if I can just add, I heard a podcast a couple of weeks ago, and the interviewer asked the doctor, how do I stay consistently stressed for 15 minutes? And the doctor said, increase your screen resolution, the brightness to its utmost highest, and just spend 15 minutes looking at social media. You will be stressed for the rest of the day.
And why is the patient asking about how to be stressed for 15 minutes?
Because they want to counteract that question by asking everyone to reduce their screen time. So if you don't do that, then you won't be stressed for the entire day. So if you do that, then you'll be stressed.
Right.
All right, Dr. Fatin, thank you so much for setting aside your time. It was a very wonderful conversation, and we look forward to having you again in the studios.
Thank you, Anil.
You have a wonderful day.
You
Thank
too.
you.
Thank you.
All right, and that was a wrap with Health on Tracks for Monday's edition on Tracks Momentum with Dr. Fatin Hanisah Firman, a consultant ophthalmologist from the UITM Private Specialist Center. And today she spoke to us about dry eyes as well as the Meibomian Gland disease. If you missed out on this conversation, worry not. You can always catch the replay by visiting our official YouTube channel or TRAXXfm official's Facebook page. And just to end this on a very beautiful note, I couldn't think of a better song than to play you this beautiful one by the man himself, Louis Armstrong. What a wonderful world. Have a beautiful day, everybody. See you in the next hour.